For this reflection on aspects of paramedic professional practice, I have chosen to focus on interprofessional communication, placing specific focus on handovers and paramedic documentation. I have used the 4R reflective model of reporting, relating, reasoning, and reconstructing to aid my reflection on this topic. So what is interprofessional communication? Interprofessional communication is the communication between the participants of two or more health disciplines. This communication occurs so that various health disciplines can work together to reach a common goal. This requires good communication and teamwork skills and a mutual respect to be had between the disciplines. The most prevalent example of this for paramedics is the communication that occurs between paramedics, police, and fire and rescue while on scene, and between paramedics, nurses, and doctors at hospital. Communication between paramedics and hospital staff occurs to reach the common goal of providing good continuity of care for patients. Paramedics communicate to hospital staff during handover and via documentation. Handover is an essential part of interprofessional communication as it is the point in which the care of the patient is transitioned from being the paramedics to being the hospital staff's. Documentation is also a key part of this transitional process as it provides a detailed account of everything that transpired while the patient was in the paramedic's care. Both handover and documentation aim to provide continuity of care for the patients. As a student, I was introduced to and taught how to handover at university during simulations. Subsequently, I have performed clinical handover to hospital staffs and completed documentation while on placement with the Queensland Ambulance Service. I always understood that handover was a crucial skill to be proficient at, as it was the point in which the patient's care changed from being mine to being the hospital's. However, handover is an area that I struggle with, and while I do utilise the handover acronym of IMIST AMBO, I often struggle to prioritise and sequence information correctly in complex cases and deliver it in a succinct manner. I also struggle to hand over to triage nurses, as from my experience on placement, I have found that no two triage nurses will take handover the same way. I was always eager to learn different methods of how to hand over, and during placement I found that each of my mentors had a way of handing over that I could learn from. During this time, I observed both good and bad examples of handovers. Some of these examples were very formal and very professional, while others were less than appropriate and showed a general disregard for the importance of handovers. When I asked why they didn't hand over properly, they would state, "They can work it out," or "It's in the report, they can read it." My exposure to completing EARF reports or documentation has been mainly while on road with the QAS, where I was taught the general layout of the EARF reports and basic techniques of how to structure my narrative. I always understood that documentation is an important aspect of patient care and it's a skill that I've been told that I perform quite well, as I try to put as much detail into my reports as possible. The mentors that I have had have emphasized the importance of handover not only as a clinical document, but also as a legal document that can protect you from liability during a coroner's inquest. Many experienced paramedics have told me, if it's not written down, it didn't happen. However, I have always found that there was no urgency placed on completing documentation in a timely manner, and we would usually get called out to another job before the report could be submitted, leaving me to complete documentation well after the case had occurred. Poor communication skills and a general disregard when completing handover and documentations by paramedics can cause pertinent information to be lost or altered. This missing information can cause patients to be triaged into the wrong category and lead to patients deteriorating and suffering an adverse event. However, poor communication and handover techniques used by the paramedics are not the only factors in why information may be missed during this time. Some of the other factors surrounding why information may be missed during handover are the poor working relationships between paramedics and emergency department nurses and the general busy atmosphere of the emergency department. Poor working relationships between paramedics and nurses are one of the biggest issues when it comes to handovers. Although paramedics and emergency department nurses generally exhibit good working relationships, paramedics often feel as though they aren't being heard, and both professions exhibit feelings of mistrust towards the other. A study performed by Abrahams in 2017 found that, from the perspective of paramedics, they felt that nurses negated their knowledge and expertise, and they felt that the triage nurse did not always consider the information that they provided fully. This study also found that, from the perspective of the nurses, that they viewed the information provided by the paramedics as inflating and almost misleading to allow them to be triaged faster. This causes disregard of crucial information and information not to be properly received by the triage and treating nurses. Now, this is a serious issue, as this bickering between the two professions can cause information to be lost, altered, or disregarded during handover, can cause patients to have adverse events, such as allergic reactions and overdoses of medication, and can lead to patients having a slower recovery times and extended stays in hospital. A technique put forward to address this issue is to have nurses and paramedics participate in a shared training program. The idea of this is to foster mutual professional respect, set expectations and guidelines for appropriate handovers, and teach a standardized approach to handover, such as IMIST or ISBAR. A literacy review done by Dawson in 2013 showed that using a standardized approach to handover is the best way to improve clinical handovers and ensure continuity of care and communication of patients' needs. The generally busy atmosphere of the emergency department can also hamper accurate information transfer from paramedics to hospital staff. People walking in and out of handover area causing interruptions, nurses multitasking, and being under increased stress from heavy workloads and suboptimal working conditions can make nurses less able to absorb the information provided by the paramedics. As this is a factor that is unable to be changed, utilizing whiteboards to write down pertinent information and utilizing detailed documentation is a great way to ensure that minimal information is missed. Documentation is a crucial part of interdisciplinary communication, as it is a written record of the events that transpired while the patient was in the paramedic's care. While information is transferred verbally during handover, paramedic documentation contains information, data, and trends not contained in the handover. These trends, information on treatment, and treatment outcomes can assist clinicians in making decisions of the next phase of their treatment. Now, while documentation is crucial and can back up what is said or missed during the handover, it is not often prioritized. Due to the high demand for emergency services, paramedics are often sent out to the next job before they have adequate time to complete their documentation. This often means that EARFs are left until the end of the shift or on break to be completed and are not left in the emergency department with the patient. If large gaps of time exist between the case occurring, the documentation of the case, and if another case occurs in between this time before the documentation is completed, this can make the recollection of the case less accurate, compromising the integrity of the documentation. As paramedic documentation can be used in coroner's court if a patient dies, an inaccurate or incomplete recount of the events could lead to negative ramifications for the paramedics. From the information presented in this unit and further research, I now understand the risks involved with poor interprofessional communication. I now understand that there is a high risk of patient safety being compromised if a handover is conducted poorly and if documentation is not submitted to the emergency department. If information is missed during handover or documentation, this increases the likelihood of a patient having an adverse event. While there are factors like a busy emergency department that are out of my control, there are certain things that I can do to improve my interprofessional communication skills. Some areas that I can improve on are the succinctness of my handovers and improving the structure of my handovers, particularly in cases where a patient has a complex presentation. In cases where a patient has a complex presentation, I need to improve my identification of the priority information and my presentation of this priority information. I also need to improve my documentation skills by increasing the amount of detail that I include in my documentation. To make these improvements to my handover and documentation skills, I will endeavour to be prepared and succinct when delivering handover. I will take a few moments to ensure that I have the attention of the receiving staff, and I will be thorough and detailed when completing my documentation. This will ensure that during my handover I deliver as much information as possible in a timely manner, and when completing my documentation, this will ensure that I provide the most complete and accurate picture of the patient's time in my care as possible. Now, incorporating good communication skills and documentation skills into my practice will minimize the risk of miscommunication occurring and minimize the risks of further harm coming to my patients.